Occupational English Test. Listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to Linda, a woman who has lower back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Linda. My name is Sia, and I am one of the physiotherapists here.
Hi Sia.
How could I help you today?
I've been getting a pain in my lower back, on the left side, around my hip and through the bum cheek area, when I'm running especially.
Okay, how long has this been going on for?
It's something I've had on and off for years. And it started off as just a kind of dull pain, and now it really feels like it's spasming or something. It hurts even when I put weight on my left leg. Usually I feel it start, and if I kind of lie on a tennis ball and massage through the muscle, it goes away. But lately it's just been getting worse, and I can feel it sort of tight through my whole hip area. And I can also feel it kind of even when I'm sitting and sleeping, or at night when I'm trying to sleep. If I roll I feel a kind of, it's hard to explain, it's like a shooting pain that travels down my leg.
Okay, so the shooting pain, where does that go?
It starts in the same place, and it goes like down the back of my leg, kinda through the back of my knee, and sometimes down to my ankle area. The pain also aggravates while doing exercises.
Okay. Are there particular exercises that do it?
Mostly, while running and walking. I think walking is even worse, actually.
Interesting. How long can you walk for before the pain starts?
I don't know. I kinda don't notice it when I'm walking, it's when I stop and then start again, yeah. So, I guess if I walked for. I'm a middle school teacher for the past 10 years and I walk every day to work. For example, which is about 45 minutes each way, and then if I run a couple of times, and then I'll notice the pain when I'm walking towards the end of the week, and it gets worse with each step as I walk into work.
Okay. Tell me more about what you are doing for sport and physical activity at the moment.
I ride my bike probably 4 or 5 times a week, not very far, maybe just 15 minutes each time, and I run probably 40 kilometers a week.
So, other than the riding and these long runs, do you do any other forms of physical activity?
Well, normally, I usually swim a couple of times a week as well. But I haven't been lately because I've been really busy at work.
Okay. And you said that you've had this for a few years. What initially brought it on?
I don't know. I think, when I was younger I used to play soccer and I had an injury where I dislocated my hip, and it was really painful. Yeah, I couldn't move for like a few weeks and I had a lot of physiotherapy and I had a lot of lower back pain after that for maybe a couple of years. But then it went away, and I haven't really had any major problems since then.
And, other than this dislocated hip on the same side, have you had any other major problems with your left leg, or with your back, or your hip or anything before?
Oh, no, nothing really.
How? I know that this has been going on for quite a number of years, but how long has this been a problem where you've sort of felt you need to do something about it?
I've been to an osteotherapist a couple of times about it in the past, just when it gets to this acute stage. So, this time it's only been like a few days that it's been really painful.
Okay, no worries. And what sorts of things did the osteo do for you in the past?
It was mostly putting pressure through that area, like massage, and then, think she used to just like poke her elbow into my left hip and hold weight there for ages until the spasming stopped.
Okay, no worries. How did you find the effectiveness of that?
It relieved it. So, basically what normally happens is it's still quite sore for a couple of days after I have treatment, but it doesn't feel so tight. And I usually have to rest off it. Yeah, for at least a few days, and then it's gone. Or maybe it's still there a little bit, but it's not like, doesn't get aggravated, and then it just drifts away.
Has your osteo given you any exercises in the past for this problem?
I do like a stretch where I kneel down and stretch through my front like hip flex area, and another one where I cross my leg, kind of on an angle like that, across my knee, and stretch through there, and I can feel that through my bum cheeks.
Oh, good. Have you found anything else that helps the pain go away?
Not really. I mean, if it feels really bad I can take maybe a Nurofen or something and it makes it better, feel a bit better, but no other sort of exercise or stretching.
Extract 2. Questions 13 to 24. You hear a general practitioner talking to a patient called Xavier Murphy. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Xavier. Come on in and take a seat. My name is Anna Malcolm.
Oh, hello doctor.
Well, can you tell me what's brought you here today?
Well, to be honest, I haven't been feeling well for the past week or so.
That's no good. What sort of symptoms have you had?
I have had a fever for a few days and I have been feeling a little bit nauseous. It comes on worse in the afternoons as well.
Okay, and with the nausea, has sort of ended up with vomiting?
Yeah, I did vomit actually, both yesterday morning and this morning. That's one of the reasons I thought I'd better come and see you.
And, are you taking anything for that? Things like Panadol?
No, I haven't. I've just been trying to tough it out.
Okay, and what about your eating habits? Have you noticed any change to your appetite?
Yeah, well, I don't seem to be as hungry. I haven't been able to complete my meals without feeling a bit sick.
Right. And, what about any other aches, or pains generally?
I am feeling a little bit tired. And, I've had pain in my joints. I've been a little bit stiff in the mornings.
Okay, have you noticed any other sort of changes, such as yellowish skin or in the whites of your eyes?
Well, I didn't, but my wife commented this morning that she thought my skin had turned a bit yellowish.
Right. What about the color of your urine? Any changes there?
Now you mention it. I do think it's become darker in color.
Now, Xavier, I would just like to get some background details before we go any further. Are you married?
Yes, I am. I've got 2 children, my son is 7 and daughter is 10.
Oh, lovely. And what about your employment? What sort of work do you do?
I'm an electrician, by trade. I work on building sites, and the company I'm currently work for now has quite a few overseas projects. So, I do go overseas quite a bit with my work.
Okay. And whereabouts have you worked recently?
Well, this year, I've been to Dubai. And I've just came from there about 10 days ago.
I see. And just tell me a little more about your general health.
Pretty fine, I think. I eat healthily. I haven't had any complaints.
And do you smoke at all?
Ah, yes, I do smoke. But I'm trying to keep it under control, but suppose I smoke about 10 cigarettes a day.
And what about alcohol?
I have a couple of beers, most days. My wife and I are trying to be responsible. And have a couple of alcohol-free days each week.
That's an excellent idea. That's very good. And now, just to go on to your family history, what about your parents? Are they in good health?
Yes, they're both in quite good health. My father, he retired a couple of years ago. But he's fine. And my mother, she's well, she does have high blood pressure. And she does take medication for that, I believe.
I see. And do you have any brothers or sisters?
Yeah, I've got 3 sisters, and they're all well.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now look at
Now you will hear a talk about ambulatory nursing care.
Ambulatory nursing care requires critical reasoning and astute clinical judgment in order to expedite appropriate care and treatment, especially given that the patient may present with complex problems or potentially life-threatening conditions. Ambulatory care registered nurses provide care across the lifespan to individuals, families, caregivers, groups, populations, and communities. Ambulatory care nursing occurs across the continuum of care in a variety of settings, which include but are not limited to hospital-based clinic centers, solo or group medical practices, ambulatory surgery and diagnostic procedures centers, telehealth service environment, university and community hospital clinics, military and Veterans Administration settings, nurse-managed clinics, managed care organizations, colleges and educational institutions, freestanding community facilities, care coordination organizations, and patient homes. Ambulatory care registered nurses interact with patients during face-to-face encounters or through a variety of telecommunication strategies, often establishing long-term relationships. Telehealth nursing is an integral component of professional ambulatory care nursing that utilizes a variety of telecommunications technologies during encounters to assess, triage, provide nurse. Now you will hear about cleaning patient care equipment.
Cleaning is the act of removing visible organic residue, e.g., blood and tissue, and inorganic salts from patient care equipment, and preparing it for safe handling and further decontamination. Cleaning should be accomplished using water with detergents or enzymatic products that are capable of removing visible organic and inorganic residues. In home care, cleaning is done manually with friction, i.e., rubbing or scrubbing the soiled item by hand with a cloth to remove soil, and fluidics, i.e., Using a detergent or enzymatic product with water, a technical way of describing the process of cleaning by the good old soap and water method. Another cleaning method is mechanical cleaning and can be accomplished through a washer disinfector, e.g., dishwasher. Patient care equipment must be thoroughly cleaned before it can be disinfected. This includes getting into the nooks and crannies, i.e., in crevices, serrations, joints, and lumens of instruments, devices, or equipment. Patient care equipment should be cleaned as soon as practical after use in the home. Before cleaning, inspect the equipment's surfaces for cracks or breaks in integrity that would impair either the cleaning or disinfection process, and throw out or repair any equipment that cannot be properly cleaned and disinfected. Decontamination is the use of physical or chemical means to remove, inactivate, or destroy pathogens on a surface or item to prevent transmission of infectious agents and render the item or surface safe for handling, use, or disposal. OSHA, 1991.
Now you will hear about nasal foreign body removal.
Nasal foreign bodies are a commonly encountered problem in acute practice. Personal experience and previous studies have shown that they occur predominantly in children between 2 to 5 years old. Children under the age of 5 years have difficulty in nose blowing. Treating this age group of children is challenging, first because of their natural fear of the unknown, and second as they are difficult to restrain. Their unwillingness to cooperate is often exacerbated by previous painful attempts to remove foreign bodies by either parents or other medical professionals. Various methods for foreign body removal have been described, such as using a wax hook, old Eustachian tube catheter, Foley and Fogarty catheters, cupped forceps, hemostats, wiry ear loops, and cyanocrylate glue. All these methods are invasive, can cause trauma to the nasal mucosa, and have the potential risk of further displacing the foreign body with possible aspiration. Several positive pressure techniques have also been described, e.g. using bag valve mask apparatus, oxygen tubing attached to the unoccluded nostril, but none have been widely accepted for regular use. These maneuvers aim to build up positive pressure behind the foreign body, which would then force it out of the nostril. The parent's kisses is a unique method which works on the same principle, but does not require the child to be restrained, and can be performed by the parent without any physical contact from the attending doctor. The technique was first described by Tiber in 1965 and involves the parent exhaling whilst kissing their child and occluding the unaffected nostril. During this procedure, the glottis is closed, so there is little risk of barotrauma, as with other positive pressure techniques. Moreover, the pressure used is low. It would be comparable to that generated during sneezing, which is about 60 mmHg. The aim of this study was to evaluate the effectiveness of the parent's kisses for removal of nasal foreign bodies in children, and to determine if this technique reduces the number of children requiring general anesthesia.
Now you will hear about vaccination.
Excluding children from your practice when their parents decline immunizations is not recommended. It can put the child at risk of many different health problems, not just vaccine-preventable diseases. Remember, unvaccinated infants did not decide for themselves to remain unvaccinated. They need your care. Make sure that parents are fully informed about clinical presentations of vaccine-preventable diseases, including early symptoms. Diseases like pertussis and measles are highly contagious and may present early as a nonspecific respiratory illness. Parents who refuse vaccines should be reminded at every visit to call before bringing the child into the office, clinic, or emergency department when the child is ill, so appropriate measures can be taken to protect others. When scheduling an office visit for an ill child who has not received vaccines, take all possible precautions to prevent contact with other patients, especially those too young to be fully vaccinated and those who have weakened immune systems. If a parent refuses to vaccinate, you can share the fact sheet. If you choose not to vaccinate your child, understand the risks and responsibilities, which explains the risks involved with this decision, including risks to other members of their community, and the additional responsibilities for parents, including the fact that, when their child is ill, they should always alert healthcare personnel to their child's vaccination status to prevent the possible spread of vaccine-preventable diseases. You also can tell the parent that you would like to continue the dialogue about vaccines during the next visit and then make sure to do so. You may wish to have them sign a refusal to vaccinate form each time a vaccine is refused, so that you have a record of their refusal in their child's medical file.
Now you will hear a nurse talking about the role of nurse in wound care.
A nurse who recognizes the early signs of skin disruption can help keep a small problem from turning into a big one. To recognize wounds early, nurses must understand where patients have the highest chance of developing a wound and check that area daily. Diabetics, for example, often develop wounds on their feet because of poor circulation and nerve damage. The elderly and debilitated often develop pressure ulcers, open areas on the skin that develop from lying in one position for too long. Some wounds, such as surgical incisions, are inevitable, but complications such as infection are not. Other wounds, like pressure ulcers, are preventable with good nursing care. Nurses can decrease wound complications by being proactive about prevention. They can frequently turn patients and examine common wound sites, such as the back and the hip bones. Scrupulous handling and care of wounds helps prevent contamination and possible infection. Good nutrition also helps wounds heal. Education, always a big part of nursing care, teaches patients and families how to avoid complications from wounds.
Now you will hear about the usage of peak flow meter.
A peak flow meter is a small device that helps you check how well your asthma is controlled. Peak flow meters are most helpful if you have moderate to severe persistent asthma. Measuring your peak flow can tell you and your healthcare provider how well you blow air out of your lungs. If your airways are narrowed and blocked due to asthma, your peak flow values drop. You can check your peak flow at home. Here are the basic steps. Move the marker to the bottom of the numbered scale. Stand up straight. Take a deep breath. Fill your lungs all the way. Hold your breath while you place mouthpiece in your mouth, between your teeth. Close your lips around it. Do not put your tongue against or inside the hole. Blow out as hard and fast as you can in a single blow. Your first burst of air is the most important, so blowing for a longer time will not affect your result. Write down the number you get. But, if you coughed or did not do the steps right, do not write down the number. Instead, do the steps over again. Move the marker back to the bottom and repeat all these steps 2 more times. The highest of the 3 numbers is your peak flow number. Write it down in your log chart. Many children under age 5 cannot use a peak flow meter very well, but some are able to. Start using peak flow meters before age 5 to get your child used to them.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
What are the symptoms of ADHD? Most kids could be described at some point as inattentive, impulsive, or hyperactive. Explanations for this behaviour vary widely, ranging from the child being overtired to overexcited. However, when such behaviour lasts for significant periods of time, and when it interferes with life at school and at home, the explanation may be due to a condition such as attention deficit hyperactivity disorder, or ADHD. Some studies suggest that about 2% of primary school-aged children have ADHD, while others have suggested that almost 18% have ADHD. However, the majority of researchers put the figure at between 5% and 10%. Regarding gender, boys are at least 4 times more likely to be diagnosed with ADHD than girls. Prenatal risks. Some studies have shown a possible increase in risk among children whose mothers used cigarettes or alcohol during pregnancy. Therefore, if you are pregnant, do not smoke or use alcohol. Environmental toxins. Exposure to very high levels of lead before age 6 or so might also raise a child's risk. Some young children are exposed to lead from the dust of worn paint in many older buildings, or from drinking water that has travelled through lead pipes. Family history. Having a biological parent or sibling with ADHD seems to raise a child's chances of developing it. According to the National Institute of Mental Health, at least 1/3 of fathers who had ADHD in their youth may have a child with ADHD. For some children who have ADHD, some foods, such as sugar and food colourings, seem to trigger more out-of-control behaviour. But food is not a trigger for many children with ADHD. Being at a party often triggers out-of-control behaviour, which might be due to foods, but the behaviour is more likely to be due to too much excitement. Sleep apnea, blocking of the airway during sleep, is linked to problem behaviours in many children. Some research has shown that about 30% of children who have ADHD have some sleep apnea. Signs of sleep apnea include snoring, often loud snoring, and stopping breathing for a brief time during sleep. Not all children who snore have sleep apnea, but if a child with ADHD also snores, this might be part of the problem. Despite at least 40 years of research worldwide, there is still no clear explanation for why ADHD happens in some children. More recent theories suggest that there is a problem with how the front part of the brain works. This causes the child's brain to deal with information and feelings in a different way from other children. It is comprised of 3 core symptom categories, which are hyperactivity, poor concentration, and impulsiveness. In order to reach an accurate diagnosis, the presence and pattern of development of symptoms in each of these categories must be considered. Hyperactivity. Children always seem to be on the go or constantly in motion. Hyperactive behaviour may be demonstrated by a difficulty in playing quietly, excessive fidgeting, continuous talking, restlessness, inability to sit still when required. Poor concentration. Children have a hard time keeping their minds on any one thing and may quickly become bored with the task. Signs that a child is inattentive include disorganization, poor academic performance, being distracted easily, forgetfulness, losing things, and poor completion of tasks. Impulsiveness. Children seem unable to curb their immediate reactions or think before they act. Impulsive behaviour may be identified through disruptive behaviours in the classroom, such as interrupting other children, poor turn-taking, blurting out answers before they are appropriate, rejection by their peers and classmates, as well as accidental injury. How ADHD affect young people. People with ADHD may not do as well at school as they are capable of because it is so hard to concentrate and stay still. In addition, schoolwork gets harder as you get older, and it may become more and more difficult to keep up with the work. Furthermore, if no one knows they have ADHD, it may mean that they do not get the special help they need. As they get older, they are expected to take more responsibility for their own learning and behaviour, and to be more organised in order to do this. This can be hard with ADHD. For young people who are not able to plan and organise themselves, for example, they don't hear the teacher's instructions, they lose assignments and homework, school gets very difficult. This can result in poor marks, being kept back in lower grades, lower self-esteem and confidence, as well as regular truancy. This may in turn mean that they drop out of school early, and leaving school early means they will reduce their chances of finding suitable employment. I would now like to describe the treatment options available for ADHD sufferers. Stimulants are the most common type of medication prescribed for attention deficit hyperactivity disorder. They have the longest track record for treating ADHD and the most research to back up their effectiveness. The stimulant class of medication includes widely used drugs such as Ritalin, Adderall, and Dexedrine. Stimulants are believed to work by increasing dopamine levels in the brain. Dopamine is a neurotransmitter associated with motivation, pleasure, attention, and movement. For many people with ADHD, stimulant medications boost concentration and focus while reducing hyperactive and impulsive behaviours. Stimulants for ADHD come in both short and long-acting dosages. Short-acting stimulants peak after several hours and must be taken 2 to 3 times a day. Long-acting or extended-release stimulants last 8 to 12 hours and are usually taken just once a day. The long-acting versions of ADHD medication are often preferred, since people with ADHD often have trouble remembering to take their pills. Taking just 1 dose a day is much easier and more convenient. As with all medications, there are side effects, and the most common side effects of stimulants for ADHD are difficulty sleeping, loss of appetite, headaches, upset stomach, irritability, depression, mood swings, racing heartbeat, dizziness. ADHD stimulant safety concerns. Beyond the potential side effects, there are a number of safety concerns associated with the stimulant medications for ADHD. Effect on the developing brain. The long-term impact of ADHD medication on the youthful developing brain is not yet known. Some researchers are concerned that the use of drugs such as Ritalin in children and teenagers might interfere with normal brain development. Heart-related problems. ADHD stimulant medications have been found to cause sudden death in children and adults with heart conditions. The Heart Association recommends that all individuals, including children, have a cardiac evaluation prior to starting a stimulant. An electrocardiogram is recommended if the person has a history of heart problems. Psychiatric problems. Stimulants for ADHD can trigger or exacerbate symptoms of hostility, aggression, anxiety, depression, and paranoia. People with a personal or family history of suicide, depression, or bipolar disorder are at particularly high risk and should be carefully monitored when taking stimulants. Potential for abuse. Stimulant abuse is a growing problem, particularly among teens and young adults. University students take them for a boost when cramming for exams or pulling all-nighters. Others abuse stimulant medications for their weight loss properties. The important diet. Current scientific evidence also suggests that diet modification can improve the behavioural symptoms of ADHD. A trial in children without ADHD challenged them with drinks containing artificial food colours and additives, or a placebo, and reported significant increases in hyperactive behaviour amongst the children who received the intervention compared to the children who received the placebo. A trial of 27 children with ADHD randomly assigned them to an elimination diet or no intervention, and reported significant behavioural improvements amongst the elimination diet group. These and a number of other studies demonstrate the association between diet and behaviour. They also demonstrate that strict adherence to an elimination diet can reduce hyperactive behaviour in children.
Now look at Extract 2. Extract 2. Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
My name's Dr. Neil Strathmore. I'm a cardiologist, and today I'm going to talk about cardiac investigations and try and tell you which test is right for which patient. Patients who present with heart problems present with a variety of symptoms, such as chest pain, shortness of breath, palpitations, syncope and edema. In addition, patients come along because a problem has been picked up by another doctor, such as high blood pressure, a heart murmur, an abnormal lipid profile, or patients present for assessment of cardiac risk to see whether they're likely to have a heart attack. Let's look at the most common cardiac symptom that presents, which is chest pain. Obviously, the first thing to do is to take a careful history of the pain, where it is and how severe it is, and in particular its relationship to exertion. Often patients don't describe this as a pain, but as a pressure. The examination is often not helpful in trying to sort out the cause of chest pain, but one should note the blood pressure and see if there are any cardiac murmurs, because aortic stenosis can also cause chest pain. It's important to note the risk factors. A technique that's very useful for assessing cardiac risk is to use the population data from the Framingham study in the United States to assess 5 and 10-year cardiovascular risk. It's important to remember that women often have an atypical history of pain. So the next step is to do some sort of test to look for the cause of the chest pain. And most of the tests are what are called functional tests, which see the effect of stress or exercise on the heart and see whether that changes something which can give us a diagnosis. The simplest test is an exercise ECG. The patient exercises on a bicycle or a treadmill while an ECG is being recorded. The parameters that are measured are the heart rate and blood pressure, and then changes on the ECG, in particular ST depression. ST depression occurs because ischemia occurs during exercise. This is a relatively simple test and inexpensive. The main problem is that its sensitivity and specificity are probably only of the order of 70 to 80% and seem to be a lot lower in women. Remembering that the test can be inaccurate means that a patient who has a very good story of chest pain that sounds like angina and has multiple risk factors should still be considered to have angina even if the exercise test is negative.